Power Movement Physical Therapy. I've gotten this question a lot this week with the holidays coming up. A lot of you are going to be spending a good amount of time on the road, and so I've been asked a lot about how to optimally adjust your car seat and car setup so that you can avoid back pain, knee pain, hip pain, neck pain, all of that. So a couple general rules to follow. When you're sitting in your car seat, it should be far enough back that when you hit the pedals with your foot, you have just a little bit of bend in your knees. You should not have your legs fully straight. Another little rule to follow with that is that there should be about 2 fingers of distance between the back of your knee and the edge of your seat. If your seat is either too far back or too far forward, it can cause some pinching on your sciatic nerve behind your leg, or it can cut off some of the circulation behind your knee. It can actually cause some swelling down in your foot. So that 2 fingers is a good benchmark to follow for that. Another thing you can do as well is check the inclination of your seat. You don't want your seat right at a 90-degree angle. You actually want it about 10 to 15 degrees back from that. So just a slight, back 100 degrees, 110 degrees at the very most, so that you're not super upright and too close to your wheel, and you can recline back just a smidge. But one of the other things we find with cars is that oftentimes even the nicest of cars don't have the greatest lumbar support. And so if you're going to be on a longer trip for more than, let's say, a half an hour, if you use either a rolled up towel, a small pillow, a roll of paper towels, something like that, and put that behind your low back where you have that curvature, just to give you a little bit more of an upright posture. Now remember, that is going to take up a little bit more space back there, so that may affect where and how you're holding onto the steering wheel, so you may have to adjust where your seat sits from there. Another thing as well with the seat adjustment is that your hips really shouldn't be lower than your knees. You want to have them in as much of your femur should be in a relatively straight line. When your knees are above your hips, it can cause extra pressure on the backside. It causes your back to curve kind of funny. So have that seat be level if possible. However, you do have to watch, especially you taller drivers. Oftentimes that causes you to have to bring your seat up a little bit, but you don't want to bonk your head on the ceiling. You should be able to see all of your controls clearly. Ideally, you should have at least a fist of difference between your head and the roof of your car. So that'll give you the best amount of viewing possible. The last thing is your head position. As traffic starts to pick up, we start leaning forward and we start getting all stressed and clenching on the wheel. What I like to tell patients is your headrest should be hitting at the middle of your headrest should be at the middle of your ears. And so when the headrest shouldn't necessarily hit your head normally when you're sitting, you should have just a little bit, maybe a hand's worth of gap there. But then what you can do is, if you notice yourself coming forward, try to sit back just a little bit, get your shoulders back against the car, and then even push your head back against the headrest just to reset your posture and reset your head position, so that then you know that you're not, white knuckling it and getting super close to your wheel. So give those things a try, and safe travels this holiday season.